Hi, my name's Brooke. I'm 39 years old and I'm rare. I'm fighting an extremely aggressive and rare form of cancer called adrenal cortical carcinoma. It only happens in 1 in a million people, and for that reason, many patients face delays in diagnosis and have trouble finding doctors who even know how to treat the disease. We desperately need your help in funding research for this rare and aggressive cancer. I'd like to take a moment to tell you a little bit about my journey with adrenal cortical carcinoma. First, in June of 2015, I went to the emergency room because I was having pain in my back. I thought it was likely a kidney infection. Anyway, at the emergency room, they didn't really find anything that I knew of at the time. But about 2 months later, I went and obtained my medical records. And as I was reading through them, I was surprised to learn that there was a 2.1 centimeter mass on my left adrenal gland. The radiology report called it likely a benign incidentaloma. In other words, they didn't think that it was cancer. So after reading the radiology reports and realizing that I really needed to get this tumor looked at, I went to a local endocrinologist, and it was really unnerving to walk into his office and have him he was actually Googling how to work up an adrenal tumor, like what tests to do, like whether to do an MRI or a CAT scan, and what blood tests that I would need, what hormonal tests that I would need. Anyway, I had all the tests done, and again, it came back. The radiology reports showed that my tumor was likely a benign incidentaloma. I was told that I really shouldn't worry about it, but I had this sinking feeling inside my gut that something wasn't right. And my primary care doctor had a sinking feeling too that something just wasn't right. So I consulted with an expert who again agreed with the radiology reports that my tumor was benign. So I returned home, and for about a year, I didn't have any further testing or scanning done. However, in November of 2017, again, I had a gut feeling that something wasn't quite right, and so my doctor ordered a CAT scan of my abdomen. That CAT scan revealed that my 2.1 centimeter tumor had enlarged, and my doctor thankfully advocated and fought my insurance company so that I could have a PET/CT scan done. The PET scan revealed that there was an abnormal radio tracer uptake within my left adrenal gland. In other words, the PET scan showed that I likely had some form of cancer. After having my PET scan done and realizing that the tumor in my adrenal gland likely might be cancer, I desperately wanted to get to a center of excellence for adrenal cancer research. Unfortunately, due to my insurance, I was unable to travel out of state to get an expert opinion and surgery consultation for my tumor. So I met with a local endocrinologist, a local surgeon who specializes in endocrine surgery, and she reviewed my records, and she really didn't think that I had cancer either. So she advised me that we would need to remove my tumor laparoscopically, which, if you know anything about adrenal cancer, laparoscopic removal of a tumor is not the best practice. The best practice is to remove the tumor fully open. So unfortunately, I had laparoscopic surgery to remove my tumor on February 6, 2018. It It would take 3 agonizing weeks to learn what my diagnosis was, but I'll never forget that phone call on February 26, 2018 at around 4:10 p.m. in the afternoon. The surgeon told me that I had stage 3 high-grade adrenal cortical carcinoma. And here's the deal. A lot of people say that I should be angry and I should be upset that so many people along the way have missed my diagnosis. If I could have had my tumor removed earlier, I probably would have had a better prognosis. But I'm not angry. I'm not upset at the people who missed it. I'm angry and upset because this disease has no awareness. We have little research, we have little funding, and it's for those reasons that people are missing this. We desperately, desperately need help. We need research, we need funding, we need awareness. Every time I go to the doctor, they're like, what's adrenal cancer? What's an adrenal gland? No one knows what it is. And most patients who have this disease, they can't just go to their local oncology center. They have to travel miles, thousands of miles sometimes, out of state to be able to go to a center of excellence. There are only like a handful in the entire United States. We desperately need your help. Please, will you help us? We need funding. We need awareness. We need you to tell your friends, tell your neighbors about adrenal cancer. Please help us in this fight. Think if it were you. Think of it if it were your children. We need your help.